The LifeChoice ACTIVOX Portable Oxygen Concentrator with proprietary auto mode and pulse wave delivery technology provides the longest internal battery life available among portable oxygen concentrators. Unlike stationary home-based concentrators or portable oxygen cylinders, the LifeChoice ACTIVOX POC weighs only 4.8 pounds and provides the patient with true freedom and mobility anytime, anywhere. The system provides up to 12 hours of internal battery life and up to 15 hours with an optional external battery. Current continuous flow therapies provide oxygen to the patient during inhalation and exhalation. The limitations of this approach are that patients can only receive a portion of their prescribed dose of oxygen while breathing at 15 breaths per minute. This is because oxygen cannot be absorbed shortly after the peak of inhalation, extending through full exhalation at each breath. As a result, a significant portion of the dose provided per breath during continuous flow therapy is lost in retrograde flow. For many patients, this retrograde flow causes nasal irritation and nose bleeding. The majority of portable systems utilize a pulse dose delivery approach. The patient triggers the pulse during inhalation. The pulse dose is delivered at a rate which exceeds the inhalation rate of most patients at 15 breaths per minute. As a result, only a portion of a patient's prescribed dose is typically received by the patient, and the remaining portion is lost to retrograde flow. Similar to patients receiving continuous flow therapy, the effect of retrograde flow often causes nasal irritation and nose bleeding. The LifeChoice ACTIVOX POC utilizes a pulse wave delivery system triggered on demand by the patient during inhalation. Pulse wave delivers oxygen continuously during the first 30% of the inspiratory period so that what is delivered is received. At 15 breaths per minute, the full prescribed dose is received with no retrograde flow. In fact, most patients report they can hardly detect the device is working because they do not feel the delivery of oxygen during the inhalation process. Oxygen cylinder tanks can weigh up to 30 pounds and typically require a cart. They are not FAA approved for air travel nor sufficient for overnight use or long periods away from home. Mobility and activity is critical to overall health and wellness of patients with COPD. Unfortunately, stationary concentrators cannot provide true mobility for the patient. The LifeChoice ACTIVOX POC will never require a cart. It can be carried as a briefcase, shoulder bag, waist pack, or backpack for 24/7 use. The LifeChoice ACTIVOX POC is equipped with auto mode technology, which automatically detects the oxygen requirements of the patient during periods of activity, when it is higher, and periods of sleep or rest when it is lower, and adjusts to provide optimal levels at all times. The LifeChoice ACTIVOX POC offers up to 15 hours of portable battery life with an external battery, no carts required ever. FAA approved for domestic and international travel, and the only POC available with auto mode technology to detect changes in respiration rate and oxygen requirements during activity and sleep.